All right, so just a reminder also, we're using a training environment for these sessions. So all information is de-identified. It is from a segment of time. It is not up to date. And it's really just to provide an overview of what the tool is going to look like. There will be some features and functionality that may be slightly different once you get access to the live tool, as we're finishing ironing out some things. But it is a good representation of what you'll be seeing once you get access to the live tool. Please use the chat feature for any questions or technical support throughout the sessions. And if you can make sure that your chats go to everyone, we do have Dylan helping with making sure all of those questions get answered. I will also be looking over to the chat screen throughout the sessions to make sure we're answering all your questions as well. Another reminder that the CCT administrator email address changed a few months ago to tencare.cct@tn.gov. So please make sure you add it to your safe list so it's not blocked by your firewall or sent to spam. We do have some great information coming out frequently on how to request access to the new tool, on training updates, and just some general information about the tool. So make sure you're, again, it's on your safe list, but that you're also reading those because it could have some good information for you. All right. So today, again, we're focusing on ADTs, or admissions, discharge, and transfers. So we're going to be covering understanding your organization's recent ADT events, reviewing ADT alerts, and understanding an individual member's ADT events and history. So with that, I'm going to go over to our tool and log in. And again, I will be logging in as a practice administrator. So logging in as a practice administrator or a care coordinator, you're going to be directed to the CC Pro dashboard, and it'll give you a quick overview of a lot of different items for your organization. Great. So earlier in the week, again, we were focusing on members. Yesterday, we focused on quality measures. Today, we're going to be focusing in on ADTs. So we can see here that we have an ADT widget. This is going to give you a snapshot of ADT data for the past 30 days. So we can see here it's broken out. We have ER bucket for any emergency room visits, admitted for any inpatient stays, and then discharged for discharges from the hospital, which would be inpatient or ER. So I'm going to click down into this so we can get more detailed report. We can see clicking down to that, it actually took us to another section over here in our left-hand menu, the admission discharge section. So that's the other way you can get to this section. Rather than clicking on the widget, you could come over to the left-hand side of the menu and choose admission discharge. So here we can search by a number of different criteria. So if you wanted to do a specific member search, you have that option here to search by member's name. You can select care coordinator. So if your practice assigns members to specific care coordinators, this would allow you to search for all ADT information by a specific care coordinator. Then you have the ability to search by date ranges. So we have admitted on, and it pre-populates with 1 month. We are working with the vendor to change this to 1 week because we know many of the organizations will look back more a week. You can also do the previous day or the last 3 days. We also have discharged on, and again, that auto-populates currently at 1 month. These are and search features, so if you're trying to find information for the past month for admissions and discharges, you need to make sure that these time frames align. If you had chosen the past day for admitted on, it would show any admissions from the past day, but discharges in the past month. So definitely want to make sure that these align. If you don't have the specific timeline that you're looking for in the dropdown, you can also search by specific date ranges. So this would be the admitted from to and discharged from to. We also have the ability to search by source. So that's meaning which hospital is sending the information. So if you had a specific hospital that you were looking up, you'd be able to find that here. You can also search by specific status. So if you want to limit your search to just those currently admitted or those recently discharged, you have the ability to do that. We also have visit type. So if you're wanting to search specifically for emergency room visits or inpatient visits. You also have the ability to search by provider. So this would allow you to search for members attributed to one of your practice's providers. It would just populate all of those providers for your specific organization, and you could choose which ones you're interested in searching by. And then you would choose save. We also have the ability to search specifically by health plan. So if you're trying to find a member with just one of the MCOs you're contracted with, you can do so. And search by members' chronic conditions or a member's risk level. We also have the ability to search by members' county, and this is their residence county. So not the county of the hospital visit, but the member's residence county. So for this, I'm going to do just a quick search. I'm going to search for the past 3 months of admissions and discharge data. And I'm going to keep all of the health plans selected. And I'm going to search by both emergency room and inpatient visits. And I'll click the search magnifying glass. And here we can see it gives us over 1,000 items. We have the member name provided, the health plan, care coordinators, if your organization has assigned members to care coordinators, admitted on date, discharged on date, the visit type, their status, so whether they're currently admitted or if they've been discharged. We also have their assigned provider, the admit diagnosis, and this will populate only if the individual entering the data from the hospital has provided a diagnosis. And then the source. So again, which hospital was sending that information. So of course, if you're getting your entire member panel ADT data, it can be a bit difficult to manipulate here. So we do have that export to Excel feature so that you can manipulate the data in Excel. So for small practices, can we keep all search areas blank and search all? Yes, you're able to do that if you don't want to select specific items. I would say to make sure that you are searching by the specific date range you're interested in, though. Sure. All right, so here is what the Excel export would look like. We have, again, the member name, date of birth, their gender, health plan, care coordinator, if one has been assigned by the organization, the MCO member ID, the MRN, and this would be for that the hospital that they had their visit with, where they were in the hospital. So if there's a department that's been sent over, that would show here. When they were admitted, if it was an ER visit, with the time of ER admission, when they were discharged, the visit type, we have their status, You have the assigned provider, admit diagnosis if that was provided, the source, and then the prospective risk score. So I know many of you will see that the phone number is currently missing here. That is something we're working with the vendor to have added, so it would not be ready, quite ready for initial go live, but we are hoping to have that ready pretty soon after that, so just stay tuned for that. And from here, you'd be able to do a lot of different data manipulation. You know, you can add your filter. You can look for individuals who have been seen in the hospital or admitted multiple times. You can, you know, filter down if you want to search by gender or health plan here. You know, admitted on date if you want to find those specifically admitted on a specific date. So lots of different, you know, ways you can manipulate the data. We have a lot of individuals who say pivot tables are their best friends, so you can absolutely use Excel to do a lot of deep dive with this information. All right, so I'm going to go ahead and go back. So again, just to show you what it would look like if you hadn't chosen any of these specifically. Mathia, let's say you just chose the 3-month date range, you'd absolutely be able to do that. And it would bring up all of the data associated with your member panel for the specific time frame. And yes, just a reminder again, you can search for the previous day's information and search for the last 3 days or 1 week. And those are just the pre-populated. You can always choose to search by specific date range also. All right, so let's say you're a care coordinator that the practice does assign members to specific care coordinators and you want to see your specific member panel. You can choose yourself as the care coordinator and make sure to choose the specific date range or time frame that you're wanting to search for. Just for this training purposes, I'm going to keep it at 3 months so we get enough data to look at. And then you would just click search. And it would pull up all of your members that had been assigned to you by the practice administrator. We can see we went down from over 1,000 to 32 members. Then you'd have the ability to export to Excel to do some more data manipulation if that's what you're looking to do. Right. So the other thing we can do is just drill down specifically to a member to find out more information. So let's say we're wanting to get more information on this member. We would go ahead and click the select member hand icon. And that's going to take us to this specific member's care plan. So again, this is currently where we'd be able to find their address and phone number, primary diagnosis, and all this good stuff that we had discussed earlier in the week. But we can also go over here to the episode section to get more details on any of their ADT data. So it auto-populates here for the past 3 months. So it can give you an idea on, you know, frequent flyers, if they've been to the emergency room, like this individual, multiple times in 1 month. You can change this time period. So if you want to look back for the past year, for example, and see how many times they had been either inpatient, emergency, outpatient, or ambulatory, and here you can narrow it down if you wanted to just be inpatient and emergency room, you could do that. If you had a specific time frame outside of the time periods pre-populated, you can put those specific dates here, and then you would do the search. So for this individual, we know they've had the 2 ER visits just in the month of September, but nothing else for the past year. And we can see when those admissions took place, when they were discharged, the visit type, attending physician, the source, and the primary diagnosis, if those had been entered at the hospital. We can also see if there's any other information by clicking this little hamburger icon over here. So the episode details are going to show the member name, the MRN from the hospital, the visit type, the hospital name, the admission and discharge dates, the admitting and attending physicians. If there was a hospital service indicated, it would be located here, and then nursing unit. We also have, if there's any medical documents that would be populated here, but most likely you would find something in notes instead of medical documents. And for this individual, there was no further data, but you would see if they were discharged, with a specific diagnosis, you'd be able to see that here. Okay, and so we can come down to the second one if we wanted to get more information and see if there's any further details, anything in the notes. So this one does have some notes in there. We can see their discharge time, admission time, they were discharged home, and we can see the primary diagnosis was nausea with vomiting unspecified. So I do have a question on where else you can find the admit diagnosis. So unfortunately, if it's not being entered from the hospital source, there's no other way to find it until a claim comes through. Once a claim had come through, I'm going to take us back to the care plan. We'd be able to go down to the bottom of the care plan page and search through the claims history. Down here, click on claims history, and it would populate here. And unfortunately, this member is not populating anything for our display, so I'm going to go back and just find a different member. I think that would be helpful. So again, if we wanted to go back to admission discharge, we'd use this left-hand menu and choose admission discharge. And again, search by the 3-month status. All right. I'm going to choose another member. So again, over here, if an admit diagnosis was provided from the hospital source, it would populate over here. And if we wanted to see a little bit more about this specific member, we'd click their hand icon. We come down to the claim summary, we can see that this individual does have some claims. So again, once those claims were submitted, you'd be able to go through and look for the specific claim associated with the visit. You can always click the plus sign and get further information on what was completed. We can also go back to episodes. We wanted further detail on those ADT visits, see if there were any potential notes provided. You just click on the hamburger icon next to the data visit that we're interested in. So with the episode details, we'd get all of this good information. And then we could come down to notes to see if there was anything else provided. So this does give a precise discharge time, their admission time, that they were discharged home, and the primary diagnosis. All right, and I did see a question come in on how to have a 7-day reminder for follow-up. So let me take you back to the dashboard for that. We're going to go up here to the abstract grid. So there is logic in the tool for adding interventions for a 7-day and a 30-day follow-up after ER visit. So for example, if a member was discharged today, they would have, if they were assigned to a care coordinator, it would populate in that care coordinator's interventions. So it would come up 7 days later. So I'm hoping that's answering your question. Please let me know. And let me just click in to the view, the eye icon to view more information. And this is basically how you would search specifically for like a reminder for a follow-up. So for those follow-ups within 7 or 30 days, if you follow up within 7 days, that closes the logic. There would not be a secondary follow-up for that same ADT event after you've completed it after the 7 days. So we can search here in the intervention section. We can see those that have been completed, any future due dates, due tomorrow or due today, and any that are overdue. You know, most of these have been input for by a care coordinator for just purposes of if you wanted to do some specific follow-up for any barriers to care. For example, this individual had they want to decrease readmissions and decrease some barriers to getting to their appointments. So they set a date to schedule an appointment and help arrange for that appointment. So let's say they had been, you have a 7-day follow-up for a member, it would populate here and you could look for the due in the future and it would populate here for you to see. The day they're due, they would populate on due today and you'd be able to see more information. So let me just search this specific member. We have decreased ER visits, improve health status. Their intervention is a case management assessment. This was scheduled for, let's see, today actually. And then who the care coordinator is, assigned provider, what that goal due date is, and then an update if there was any update. We can see that this individual is actively enrolled. It's showing that it is intervention that is logged as due today. And there is this little edit button. I'm going to click that. So let's say you reached out to this individual and you're wanting to close this intervention and add any notes. Let's just say contacted and scheduled an appointment. And then you would just click this checkbox to attest that you had reached out to the individual. And then you would click save. So now it's been taken off your due today bucket and it's been added to the completed bucket. And if you want to go back and view any that you had completed, you go ahead and click this eye icon. You can get any updates, any notes that you may have left. But again, this is how you would manage those auto-populated 7-day or 30-day follow-ups after a visit to the emergency room. So hopefully that answers your question, Dorothy, but if there's any more detail you'd like on that, please just let me know. All right. I'm going to go again back to our care dashboard. So another great feature about having members assigned to a care coordinator is those care coordinators, once logged in, would be getting alerts on any time one of their members have ADT data. So we would, let me just click this. So if a member was admitted or had an ED visit for today, it would populate here in this green box. Anyone had been discharged, they would populate here in this yellow box. So the alerts automatically come up with today's date, but you can search back to the past week, last week, this month, and then last month. So this can be another good helpful reminder to indicate that, yes, you indeed have a member who's just been admitted to the hospital, and maybe you want to go check your specific member feed in the ADT search to see whom that is. Sure, yeah, so let me just show you one more time. So to get to the alert, it's up here in this right-hand icon menu. You'll click the bell alert button. And it is a pop-up, so again, like we had talked about yesterday, make sure your pop-up windows are enabled. And if you want the bigger view, you can expand it. And it'll give you today automatically and any changes for your member panel. So let's say you you had a member that you'd heard has been admitted to the hospital or had an ER visit and you wanted to go look them up. We can do an individual member search. So we're going to go back to the admission discharge section. And we will look up the specific individual by name. And I do need to change this to the 3 months. All right, and we can see this specific individual has had 2 emergency room visits in the month of September. So if we want to look at one of them, we could choose a specific one to look into, but since this is the same member, it's going to take you to the same care plan. So it really doesn't matter which one you choose. Because again, it'll take you to that care plan for that specific individual. But if we want to get to the details of their specific episodes, we would again click on the episodes and we get to that detail of all of their emergency room visits for the last 3-month time period. And we would just click here again on those hamburger icons to see any episode details or notes that had been provided. So again, there's several ways that you can search the ADT, whether it's searching for your entire member panel and wanting to do some data manipulation by exporting to Excel, or divvying out to specific care coordinators for follow-up. You can search by care coordinator just to see the specific members assigned to one specific care coordinator and do some data or outreach based on that. And then you can search for a specific member to see how frequently they've been visiting the ER or been admitted for a specific time frame. Okay. All right, any specific questions on ADT so far?
Yeah, hey, Ali, there's one good one in the chat from Mathia. She asks, kind of this question about if you've got members or if your organization has assigned members to care coordinators, when you log in, would a care coordinator only see their members or would they be able to see everybody? And just how's that breakdown kind of work?
Sure, yeah, so that's a great question. You'd be able to see all members with ADT data for your organization, unless you select the search feature to narrow it down to the specific assigned care coordinator. So, if you wanted to look up both, you can do that. You would just leave the care coordinator section blank if you're wanting to see your entire practices population. But if you wanted to see your own, for example, if you were a care coordinator, see those members assigned to you specifically, you would just select yourself and all the members attributed or assigned to you would populate down here. So yes, good question. You can do both.
Gotcha. And thanks, Ali. And then she actually follows up and it says the member will only show up if the clinic is named as that member's PCP. And Mathia, thanks again for mentioning kind of or describing the setting of your organization and that it's a small one. So Ali, just in terms of general attribution, the folks on the call today would only be able to and would only ever be able to see members who have been attributed to their organization. Is that correct?
That's absolutely correct. Yes, you would only be able to see those attributed to your practice. Sure, no problem. Okay, so I know I let our MCO partners know yesterday that I would log in again today as an MCO admin to show you what the ADT section looks like for you all. So I am going to do that now. Again, when you log in as an MCO administrator, you have two options. Either to go to 3D Analytics Express, which is where we were seeing those quality measures and those reports, or you can go to Care Connect Pro, and this is where you come for that ADT data. So MCO admins only have the ability to go into the ADT, so it's automatically going to take you to the ADT search section. And so you can see this is pretty similar to what the care coordinators and the practice administrators have as their search criteria. There are a few minor differences. You could search for a member by name. Of course, you have the ability to search for admitted on in specific time ranges and discharged on for the same ranges. You can also search for a specific date range if none of these pre-populated meet your needs. So admitted on, you just enter the dates from and to here. For the discharge, you enter from and to down here. You can also search by source, so which hospital, if you wanted to search specifically for one or maybe, one at a time, unfortunately. Status, if you wanted to search all those currently admitted or recently discharged, you can choose that here. You can search by visit type. So if you're wanting to just focus in on maybe emergency rooms or only inpatient visits. You can also search by an assigned provider. So the list for MCOs will be longer since you have more providers attributed under each different practice. So you could either search by name or phone number, whatever your preference is. You could do that here, but it would probably be easier to search for a specific individual rather than going through the list. You can, there is a health plan selection here, but that's really for the MCOs. It's going to give you the option to select either your PCMH or THL panels. You would only be able to see your specific MCO members. So you wouldn't see, if you're blue, you wouldn't see United or Amerigroup here, just the option to choose PCMH versus THL. You could also search by chronic conditions. So this would be the member's chronic conditions, the member's risk level, or the member's county of residence. So for this, I am just going to choose 3 months, and let's see all of the members that will populate that had admissions or discharges within the past 3 months. And since this is a training environment, again, the data is not just de-identified, but very limited. So we only have a few to look at here, which is why I didn't want to narrow the criteria too much. So with an MCO, it is still a pretty big panel. To get more information, we can export to Excel, but I do just want to call out the column names really quickly. So you'd have the ability to see the member's name, their region. So that's really just going to say if they're, again, those PCMH or THL, when they were admitted, when they were discharged, the visit type, the status, so whether they're currently admitted or have been discharged, the assigned provider, and the source. So let's export to Excel and do a bit more of the data manipulation that you may be interested in. Again, apologies for the delay. It always takes a bit longer when you're sharing your screen doing this. While I'm waiting for this to populate, I will just call out one of the differences in the search criteria. You can see you don't have the ability to search by a care coordinator as an MCO admin. All right, so here is the export. And you can see this is going to mimic very closely the export that you'd have as a care coordinator or practice administrator. You'll have the member's name, their date of birth and gender, the region, which again will just be PCMH or THL, their MCO member ID, the MRN from the hospital they had their visit, any assigned unit they had been admitted to, the date of admission. If it was an ER visit, it'll have the time of admission, the date of discharge, the visit type, their status, assigned provider, and it'll have the source and the individual's prospective risk score. And then from here, you'd be able to do any data manipulation that you're looking to do, whether it's pivot tables or just filtering out by different measures. Okay, so that's some really good feedback. Thank you. I'm seeing that it would be really helpful to have the TIN number associated on this export. So thank you for that feedback. We'll definitely get that over to the vendor for something that will be available, not at Go Live since we're close to that, but we'll try and get that in as soon as possible. So thank you for that feedback and more to come on that. Okay. All right, so any questions on either the export or even the search criteria that you'd have for ADTs as an MCO admin? All right, so I do see one question. So you will be getting new usernames for this new system. and we'll be sending out the date of the launch pretty soon, and you'll get the, there we go, thanks Dylan, yeah. You'll be getting your user credentials from HealthEC shortly before it goes live. You will get initially a temporary password so that you can log in, and you'll reset it to something secure and then not share it with anyone. So it'll be a whole new way to log into the system from Altruista. So good question. All right, any other questions on ADT, either from practice admin, care coordinators, or MCOs? All right, so I'm just gonna go back into the care coordinator. So we don't have load date that populates within the tool, just the admission and discharge date. All right, so just as a quick overview, I'm coming back to the care coordinator, practice administrator version where we're seeing the dashboard. We went over seeing a quick view of the ADTs at a month level. We can get to the member search for ADT specifically if we click down into the ADT widget, or we can click over here, the admission discharge in the left-hand menu. And we can either pull for the entire practices panel, or you can search by care coordinator or specific member. Lots of ways you can filter it out. So great question on the ADT information. ADT information is near real time. So it comes through a few different sources before it's loaded into the CCT, which is why we don't say it's instant, but it is near real time. So it's constantly being loaded throughout the day, every day. So yeah, let me go back to the care dashboard for that question on, I'm assuming you're talking about marking outreach after an admission or, excuse me, an ER visit. If you had that populated, you'd come over here to interventions, and we'll click the eye icon. So let's say, for example, you had a follow-up populated due today that you wanted to indicate you had done some outreach since their admission or their ER visit. You come over here to this little pen, click edit, and then you would put your notes saying that you had addressed the need, and you would just click the checkbox and attest that you did indeed complete this action, and then click the floppy disk to save it. And once you did that, it would leave your due today and go into the completed bucket. All right. If you're, still in the intervention section, if you like using this, this can be a very useful tool to help track some of the outreach maybe needed. Again, you do have the due in the future, due tomorrow, due today, or overdue. So it helps manage those for different time frames. And then you could also search up here if you're wanting to look by a specific measure, if that's also helpful. And we understand, the intervention section is not required. We understand some organizations would not want to use it, but it may be helpful for some individuals. All right, so there's a question on if you wanted to add an intervention, you can absolutely do that. The only ones that are auto-populating are the 7 and 30 day after an ER that will populate here. Otherwise, you would need to add an intervention to create a reminder to do some follow-up or contact the member for whatever reason. You can add that here. Here we go. So it would take you to this add intervention screen, and you would want to put in the member name, and then you would just select the specific problem. So let's say you're working with someone on failure to thrive, and you would select some specific goals that you're trying to help them address. So let's say you're working on improving access and coordination of care. Maybe you're also working to decrease ER visits. And then some of the barriers perhaps are maybe denial of condition, let's say, or maybe they have some cognitive issues or lack of a support system. You put all those barriers here, and then you choose specific interventions that you're wanting to work on. Maybe they need help with arranging transportation to get to their appointments. You can add that, and again, you can add multiple here, maybe even arranging an appointment. You can see that it'll populate today's date since you are adding the intervention as of today. But then you'll need to choose a goal date. So let's say you want to follow up with them in 2 weeks. You can choose that date. And this can be done once, or you can make it a recurring contact if you want to do that. Oops, let's see, 2 weeks. So we're scheduling that intervention. You'll have a reminder the day before and the day of 12/3. And again, it can be one time, or you can make it recurrent. Let's say you wanted to follow up with them every month on the 5th, okay, and you'd save it. So you could definitely do that. And it'll show currently, since you've just created it, that it's in progress. And you can select yourself as the care coordinator. And then again, that floppy disk will allow you to save it. If you had any notes, you would want to put that here. Since I didn't put in a specific member name, it is not going to let me save this, but this is how you would add an intervention. And once you did this, then it would populate in those due for the future, due tomorrow, due today, or overdue buckets. Once you edit those to mark them complete, it would then go to your complete bucket. So again, this is manual entry. We know not everyone will want to use this, but it could be helpful for some care coordinators in helping to manage care coordination, outreach, etc. All right, any other questions on ADTs or interventions? All right, so that's great. We have finished the 4th day of training. So what we're going to do now is pull up that poll again so that we can get your feedback on how today's session went. Really take that to heart so we can try and make these sessions as effective as possible for you. While you're all taking that poll, you can also put in any questions that are coming to mind in the chat, and I will answer them for you. Once you're done completing the poll, you're free to leave for the afternoon. Tomorrow, we are going to be having a question and answer session. So any questions that come to mind after you leave today, please come and we will answer all those questions. We will also be doing a recap of the things that we've covered this week, because we understand we've gone over a lot of information. So we will be doing a quick recap and then answering all those questions that you all have. So appreciate your taking the poll in advance, and I will be sticking around to answer questions. Thank you so much.
And Allie, we did have one extra question come through, kind of going back to the interventions piece. The question is about kind of the connection between interventions and the goals and barriers, and how it ties to maybe the care plan, but also sort of the requirements for documenting things in the care coordination tool. So the question is, would filling out the goals and barriers in the care coordination tool fulfill any of the care plan aspects of care management, or do those things still need to be documented in a user's EMR? So while people are responding to the poll, if maybe you could just touch on the concepts of documenting things in the tool versus the EMRs and kind of the interplay between those two things.
Yeah, so that's a good question. So like I had said, using the interventions is absolutely an individual choice. You do not have to do that. The CCT is not meant to be the record of source. So the record of truth is always going to be that EMR. So again, that's why we're not requiring anyone to use the manual entries of the interventions, but we do have that there because it can be helpful for some individuals. So record of truth is the EMR, but the CCT can be helpful. If you had indicated problems, barriers, and goals on the care plan, having those interventions would tie in together so that you could be managing specific interventions to close those or end those barriers, remove those barriers, help the member get to a better level of care. It would also be able to be tracked by anybody else in your organization when those, barriers have been addressed. So it can be helpful, but again, it's not required, and your EMR is definitely remaining your source of truth.